morning, guys and teacher. Today I'm going to tell you about oral disease in San Vicente, Chucuri. My group is conformed by William Sanchez Salazar, Maria Fernanda Pavón Rivera, Karen Vargas, Ana María Rincón, and who's talking, Andre Chaparro. Okay, fear of us, we conduct a survey of rehabilitated dentist who was working in San Vicente Chucuri. Her name is Catherine Martinez. In the survey, we asked him a series of questions in order to identify what was the most prevalent oral problem in the municipality. Okay, first question. How long does an average consultation take? Rating 55 minutes on average, feeding of chimps 1 hour, cleanings 45 minutes, and more complex treatments in 2 to 4 hours. Okay, what is the most common oral disease in the population of San Vicente Chucuri? She told us that the most prevalent disease in the municipality were cavities and pulpitis. So, what is the meaning of dental caries? Okay, this is a multifunctional disease that affects the hard tissues of the oral cavity caused by the desmineralization of dental enamel, depositing in the dental biofilm. For example, um, what is the factors to present in the dental caries? This is a lack of hygiene, a little availability of health service, habits, for example, smoking or using your teeth as a tool, food consumption in excess of sugar, soft diet, and sugary drinks. So, what are the things and symptoms of cavities? Okay, first manifestation of the effects of demineralization. First, you can view a white lesion, then due and destruction of enamel, damage to dentin, and slight discomfort, sensitive when drinking some hot or cold. Okay, treatment. First, if it is the only enamel, the patient should improve his oral hygiene, explaining how to brush and floss, and you will be rescheduled after a while for a control review. Second, when the caries affects only enamel and dentin. First, all infect and diseased tissue is removed. The tooth is rebuilt, filling the cavity with a composite resin to provide the filling with the same color as the tooth and add their better to it. 3. If the caries is deep and has affected the pulp, a root canal is required. For this, the pulp chamber is accessed and all the vascular nervous tissue is straight, including the roots. It should be cleaned very well. It is filled with a bacteriostatic material that will prevent the infections from reproducing. And finally, the tooth will be reconstructed by placing a crown or sleeve. Okay, prevention. For me, this is the most important part of treatment as we need to make the patient understand the long-term damage if it doesn't change your oral hygiene habits could end in a more advanced disease. Okay, first, you need to brushing your teeth after every meal with toothpaste and contains fluoride. Use dental floss to clean the interdental spaces. Periodic rinses with the fluoride mouthwashes. Sealing of showing surfaces to prevent the appearance of dental plaque. Application of a light current sealant is the most important term to prevent the caries in their kids 4 to 6 years or 7. Fluoride application, regular visit to the dentist once or twice a year. So, what is pulpitis? It is the inflammation of the dental pulp produced by untreated cavities, trauma, or multiple phases. Its main symptom is pain. Types of pulpitis. Reversible pulpitis. The pain appears when a stimulus is applied to the tooth, generally cold or sweet. After the stimulus is removed, the pain stops in 1 or 2 seconds. Irreversible pulpitis. The pain appears spontaneously or lasts a few minutes after the stimulus. Generally, head, less frequently cold, has been removed. A patient may mistake the tooth where the pain originates. Then the pain may stop for several days due to the pulp necrosis. When the pulp is complete, it does not react to cold or heat. As the infection progresses, the tooth becomes sensitive to pressure or percussion. Diagnosis. Instruction or the diagnosis is based on the history and physical examination, which makes use of a stimulus, application of head, cool, or percussion. Dentists can also use an electric pulp tester, which indicates whether the pulp is alive but not whether it is healthy. If the patient feels the small electrical charge delivered to the tooth, the pulp is alive. X-rays determine if the inflammation has spread beyond the apex of the tooth and help exclude other diseases. Guidelines here, you can also put in the amount of allowed for this. Treatment. Reversible pulpitis. The vitality of the pulp can be preserved if the tooth is treated by healing the caries. Irreversible pulpitis. Its sequelae require endodontic treatment, root canal, or extraction. In endodontic treatment, an opening is made in a tooth and the pulp is removed. The root canal is debrided, filed and filed with gutta-percha. After treatment, the root canal healing is done by resolution of symptoms and reducing image in the root area over a period of months. How would you rate the oral health of the patients in this population? It should be emphasized and thus and population prefer private appointments that are published. Sidewalks near the town, health is low. In town, health is medium height. How often do people from the municipality visit your office? The frequency with they visit the office is very frequent, since the visit to the dentist is very important to them. How would you rate the plague condition of the population? Unfortunately, in the rural area, it has been that the level of bacterial plague has been high as they not have the ease of fighting attachment in oral aging, a brush, a toothpaste, a mouthwash, and floss. And in the urban area, we find an average level science people and they have to be able to access the attachment of oral hygiene more easily. Okay, what methods do you use to explain your patients the correct way to brush their teeth? Okay, first, I educate them through the macro model, doing the exercise that they should do, and also doing the explanation with objects with the dental instruments. How do you consider education about oral hygiene of the population? Do the socioeconomic conditions the urban area receive more information than that of the rural areas, and also the urban areas presents greater interest in the education and oral health? On the other hand, the village expects in it to pass a pathogenic period. Are health brigades carried out in the municipality? In the municipality, the health brigades are carried out the hospital. So thanks for your attention, and it is all.